Senator Bernie Sanders and other Democrats continue to praise single-payer health care and how it has been implemented in countries like Canada. Listen.
One of the examples of a single-payer system that is working well, that is popular, is the Canadian system, providing quality care to all of their people in a far more cost-effective way than we do.
But a new report from Canada's Fraser Institute shows that long waits for surgery and medical treatment cost Canadians $1.7 billion in lost wages and time, at least last year. So what are Democrats missing here? Radiologist Dr. Nicole Saphier has the answer for us. So, Dr. Saphier, for our folks that are watching at home, they want to make sure that America is going to take care of them in their old age. Are we on the right path?
To be honest, the answer is no right now. And as you alluded already, Canada, this recent survey that came out, admittedly, the way that they get some of their results does introduce some bias. However, you cannot deny the fact that the wait times Canadians are seeing are appalling. On average, they're about 21 weeks just to see a specialist. And that's not if you have a complex disease needing spine surgery, orthopedic surgery, or in rural Canada. They're waiting up to 42 weeks, some over a year, to see a specialist.
And that survey just dealt with the costs. It doesn't mention how many people actually die while they're waiting to get in for treatment.
That is absolutely true. And what we're missing is when you're waiting to see this specialist, you're potentially debilitated. You're not working. You're missing out. So not only are you missing out on that revenue, but your employer is as well. And now you have a potentially reversible disease, which maybe is now permanent because you have waited so long. Now, in the United States, a similar survey from 2017 showed the maximum wait time that we saw was less than 6 weeks. And what concerns me is that's actually up 30% since the implementation of the Affordable Care Act.
Really?
Now, 6 weeks is nothing compared to 21 weeks. Correct, but we are going in the wrong direction. And something that's even more astonishing, for the first time in over a decade, our medical school applications have decreased. That means fewer people are applying to medical school. So our wait times are up and people aren't going into medical school.
Because they're not making as much money?
It's not, so that could be part of it. Reimbursements are absolutely down, but it's not just reimbursements are down. Work hours are up. The administrative and bureaucratic burden put on physicians and healthcare providers is astonishing.
Okay, so if the president's watching, if Congress is watching, what do they need to do to make sure we don't go down the wrong path?
Listen, for every 1 hour doctors spend seeing patients, they do 2 hours of paperwork. That needs to go. We need to stop and remove some of these barriers between the physician and a patient. We already have Alex Cesar committing, saying, I'm going to tackle drug prices. And you know what? He has the experience to do that. We also need to improve the way Medicare and Medicaid are delivered. We need some patient accountability and patient education. We also need to make sure that the HSAs are adequately funded so people are aware of what they're paying for. If they're using their money in their HSA accounts, they're not overutilizing the system, because now they're a little bit more aware. And we need direct access to primary care and preventative medicine.
What do we need to do as the patient? How can we be held accountable? Because a lot of this is on us, too. We need to not drink as much, not smoke as much.
Better choices. We need to take responsibility for our own health. The world, the government, our physicians are not necessarily going to take care of me. The far majority of diseases are preventable. The number one and number two cause of death in the United States are cardiovascular disease and cancer, and the far majority of those can be prevented by good choices.
Are most people not going to the doctor because they can't afford it, or they're too scared?
A little bit of both. A little bit of both. You need good access to primary care doctors, primary care medicine. You should be seeing a doctor when you're healthy to make sure that you're on the right path before it gets worse.
Be proactive.
That's right.
Thanks so much.
Thank you.
Dr. Saphier, great to see you.